So, Dr. Scott Bradley from Las Vegas, Nevada.
Very well.
How
Said.
I
Very
say,
well
right?
said.
Nevada, maybe Nevada. Forgive me. We're going to talk today about the frequency-specific laser therapy that I know you do in your practice, not just on small animals, but also you personally own some equines, horses, for trail riding. Tell us a little bit about what you like about this particular laser, which is a Class 2 laser.
Correct.
And how you think it benefits your practice.
I absolutely love the laser technology and what it's been able to do. One of the many things that really are significant to me is that there's no downside to it. You can't do any harm, which is our basic tenet. We do no harm.
So let me stop you there, because I've heard that some of the lasers, dogs have caught fire or they start smoking, so this particular laser you're using doesn't do that?
Right, there are lasers that create a lot of heat and can heat tissues up to the point where they do damage. And there's a certain amount of heat that can be produced by a heating pad or whatever that can improve blood flow and make it feel better for a while, or make a pet feel better. But that's a temporary fix. It does improve blood flow to the tissues, but not for long. The Class 2 lasers have a completely different approach to it, and they do not heat tissues up. Basically, their basic function is to improve cell-to-cell communication and improve cell rehabilitation. So, if you got damaged cells that you can rehab, it will help. A lot is not necessarily better. A lot of power is not the answer to many of the situations they face. The thing I love about the laser that just makes such a difference is it offers hope. There are so many cases that we run into over the years that you just know you've given them everything you've got. You've done everything medically the best you possibly can, surgically the best you possibly can, and yet it's not enough. And this is one more significant tool to make our patients better and to make them well.
So the average layperson is going to come into your practice, the client, and never have heard of this, or maybe they've heard of a laser and that's that little red pointy light that you play with a cat with, or maybe it's a surgical laser where you've had eye surgery done or something like that. It's a giant leap of faith for a client who, in most cases, isn't scientifically trained to come back to believing that you're going to get this machine with its pretty little lights and shine it over the dog or cat or whatever it happens to be, and everything's going to be just hunky-dory. So how do you get to persuade or convince them or get them to understand that this is another modality that we can use to help your pet?
That's a great question. Educating them is the key to it. Educating one as far as the potential for benefit is huge. Educating them as to the potential for not harming is huge, and also economically helping them to understand that it's a great investment in the wellness of their pets.
So give me a quick rundown on some of the conditions that you might use your laser for, the Class 2 laser, as opposed to the Class 4 lasers that a lot of veterinarians are carrying because a sales rep comes in one day and says, oh, you got to have this, it's the latest thing, you can charge a lot of money, good to go.
That's huge. I don't know all of what, say, a Class 4 sales points are, but neurology cases, paraplegics, hemiplegics, spinal disc problems. If they've still got, if that spinal cord is not dead, it can be rehabilitated. Neurology, seizure cases. We got pets that they come in, it's their first seizure, we will do laser therapy on them. We may never see them again. They may not need it, as if we didn't laser, that may be the case. But we have cases where we've had them on anticonvulsant therapy. We've pretty much maxed them out as far as the amount of medication we can give them, and they're still seizuring. And we've gone through a series of VOM adjustments and laser therapy and seen that disappear or get significantly less frequent. So those are, you can't touch that with anything else. There are cases where we've got hepatic issues, adrenal issues, diabetics, basically soft tissue organ dysfunctions that are, a class 4 is not going to touch. They're pretty much going to be directed towards wound healing, dermatitis, arthritic degenerative joint problems, and they can be quite effective at some of those. But the class 2 with a low level laser can be extremely effective at a lot of those soft tissue problems. Cystitis, cats with inflamed bladders. Oh, what a difference that makes. Chronic renal failure, hepatic issues, intestinal, just inflammatory bowel disease, IBD, other intestinal enteridities can be just made better with proper case management and effective use of the laser. Respiratory issues, asthma, bronchitis.
So in other words, the list goes on, right?
Oh, just infections, dental infections. It's not going to make them go away, but it's going to make them better and make the patient more receptive. Yeah, pain and inflammation is a huge benefit.
Do you think as well what helps now is a certain part of your clientele? We all know they go on the internet. That's the first thing. The oracle is going to tell them what to do. Do you think things like acupuncture in human medicine has really helped them understand that, hey, we need to be doing something in the veterinary field, and that maybe veterinarians are a little behind in embracing the alternative or complementary, whatever the in phrase is for the time, that it's time that we all kind of got with the program and moved on?
Some never will. It's just you've got enough on your plate. But I can tell you, if you're looking for something to help with those frustrating cases that you just don't have answers for, you've done all you possibly can, it does not make sense to not try this. The cost, initial cost for going in is very affordable. We've got 2 lasers in our office. We paid for our first one in 6 months. We paid for our, and we upgraded and went to the next model up and paid for that in another 12 months. So, and there's virtually no ongoing costs with it. So, it's just a great investment from that standpoint. But unless you've got it figured out and all of your cases go exactly like you want them to, and you feel that you're doing the best for your patients and your clients, you're missing it. You're just flat missing out on a great opportunity to make a difference in your patients and your clients' lives.
So final question. I'm going to come to your practice. I'm taking your 2 lasers. You going to take me down?
No, I won't have to. No. You won't make it out the door. My technicians
Your technicians are
hamstring you and hang you up in a kennel, and you will not see the light of day ever again.
Thank you so much, Dr. Bradley. It's been a pleasure.
You're welcome.